Welcome to Wellness and Wisdom with me, Dr. Nadu Tuakli. Here you can expect to hear conversations about everything women over 40 care about. From optimal wellness and peak performance, from intimacy to travel and finances and more. I will be speaking to interesting women and sometimes men to educate and motivate you to live your best life. If you want to find out more, please head over to my website, drtwakli.com, or subscribe to my blog. You can also read my book, Sex, Sanity, and Sleep. We are in this together. Welcome back to Wellness and Wisdom with me, Dr. Nadu Tuakli. Now, do you believe there is no cure for Alzheimer's? If that is the case, my goal today is to change your mind. How can I do that, you might say? Well, the proof is in the pudding. Today, I'm going to prove you wrong, but don't feel bad. You're not alone. Millions of doctors and nurses are unaware that Alzheimer's can be cured. What do I mean by a cure? What I'm talking about is a reversal of the dementia that categorizes this condition, as in getting your memory back. What else is important? I've mentioned before that the over 80s are the fastest growing segment of the population. And we probably all run the risk of developing dementia as we age. But now there's no need to fear it because the causes can be unearthed and it can be prevented and reversed. I spoke with an Alzheimer's survivor, Dr. Lucy Waletsky, in an earlier podcast. But if you'd like to hear from even more survivors, later on in this podcast, we'll tell you about a documentary where you can watch even more. At this point, there are hundreds of people who have been able to reverse their Alzheimer's. At some point, even the naysayers will have to admit the validity of Alzheimer's reversal because so many survivors are speaking out. It is truly a medical breakthrough, and I'm always happy to speak with the survivors and pass along their universal message. Alzheimer's can be cured. If you or someone you know is struggling with memory issues, do not wait. The time is now. Help them and help yourself. I'm here to give you the information, take it and run with it. I would love to spread the word on this important topic. Just last week, I had 2 new Alzheimer's patients join my practice, and I could feel the devastation that this condition has wrought on their families. Today, I'm going to introduce you to Dr. Sally Weinrich, another Alzheimer's survivor, who is selflessly giving of her time to others with memory impairment, hopelessness, and depression. She has been there. Dr. Sally Weinrich, PhD, RN, has a bachelor's, master's, and doctorate in nursing, and she is a renowned researcher. As a nurse researcher, her research in prostate cancer screening, funded by the NIH and the American Cancer Society, received national and international recognition. She retired in 2008. At 68, Sally had symptoms she could no longer ignore. She was treated for depression, and she was given Alzheimer's drugs that did not work. They made her worse. As a researcher herself, she was smart enough to drop out of the trial. We're going to get personal with Dr. Weinrich, as I want you to feel you have actually met an Alzheimer's survivor. Don't take my word for it. Take hers. I am just the medium. So, welcome to Wellness and Wisdom, Dr. Weinrich.
Thank you.
Can we call you Sally?
Yes, please do. And hello to all your audience.
Can you tell me a little bit about your personal life?
I'm a retired nurse. I have 5 grandchildren. I'm a proud grandmother. Enjoy the outdoors. I'm married happily. We did have a dog who was the 5th or 7th generation golden retriever, but he's no longer with us. In my spare time, I love walking, hiking, swimming, kayaking, talking with friends, eating and reading, and watching podcasts like yours.
Now, do you have Alzheimer's in your family? And
Yes.
What is your APOE status?
Yes, and yes to both. Yes, I had 2 aunts who were surrogate mothers to me, both on my mother's side. And both of those had advanced Alzheimer's and died from Alzheimer's. And on my father's side, I had also 2 relatives, both an aunt and an uncle who died from Alzheimer's. And I had always assumed that I had the so-called Alzheimer's gene, which is the APOE4. I did when I had my cognoscopy through Dr. Bredesen. The first one I had was in 2016. I did get tested for the APOE4. I have one mutation. It's called heterozygous, and it's called APOE34. That means that I have 30% increased risk of developing Alzheimer's, which I have. I do have Alzheimer's, and I have reversed it. And that means I've got from either from a mother or my father one of the APO4 genes. If I had gotten both from a mother and father, I would be and had two mutations, I would be called homozygous, and my risk would be increased 70%. And I did do genetic research on the prostate cancer gene, and I want to emphasize what most people don't understand about genetics, and that is that it puts you at increased risk for the disease. It does not mean a surety that you'll get the disease. And I'm a living proof that if you do what you need to reverse and or prevent Alzheimer's, even if you are APOE positive, you do not have to have Alzheimer's.
Great information. Now, when did you first realize that something was wrong?
The backdrop I have to tell you is I'm a nurse, and my original specialty before oncology or cancer was gerontology, which is caring for the older people. So as a nurse, I had both taught about Alzheimer's, and I also had cared for Alzheimer's patients. And at the same time I was caring for Alzheimer's patients, I had my loved aunts who were like mothers to me diagnosed and dying from Alzheimer's. So I always had in the background or fear, as many people still do today, that I would get dementia or Alzheimer's as I aged. And in my 40s, I had a background awareness or fear of it. And then in my 50s, in the year 2000, when I moved from one job in South Carolina to a new job in Louisville, Kentucky, I, unbeknownst to me, moved into a home that had a lot of black mold in the basement. And at that time, I did not know that black mold could cause many negative health problems, including it's one of the 6 causes of Alzheimer's that Dr. Bredesen has identified. I was diagnosed with depression for the first time, and depression is one of the symptoms of what Dr. Bredesen published in 2018, I believe, a paper called Inhalation Toxins. And depression is one of the symptoms. But I did not realize that the mold was causing both my depression and my cognitive problems until I read Dr. Bredesen's article that I believe came out in 2018 titled Inhalation Toxins, One of the Causes of Alzheimer's. In the home I lived in between 2000 and 2005 that had mold in it. That caused the symptoms of both cognitive confusion, like I had trouble dealing with my emails at work, which is, a basic level of skill.
These days.
Although it's complicated, it's time consuming. It doesn't require a lot of cognition. I had trouble dealing with my emails. I was depressed and also had anxiety for the first time. And I also had other biological markers like low zinc and some other blood markers that indicated, in retrospect, that I had early stage Alzheimer's, but I did not know, and it was not diagnosed until 2015. I knew I had what Dr. Bredesen calls subjective cognitive loss. I knew I was mixing up things. I had more than normal aging changes. So I enrolled in a research study because I was a retired researcher, and I believed what was commonly told at the time, that there was no answer for Alzheimer's, but I believed research had the answer. And indeed, Dr. Bredesen's research does have the answer. But the research study I enrolled in, which was testing what was commonly at the time and unfortunately still is believed to work, which is called an anti-amyloid drug. I enrolled in a trial where I got an IV, and the drug's purpose of the IV, it was what you call a double blind, meaning I did not know whether I was randomized to the control group that got a placebo or a false medicine or the medication that they were testing. But I myself, since I'm a researcher, tested myself after each IV administration by subtracting in a retroactive manner 7 from 100. And that's one of your basic cognitive tests, like 7 from 100 is 93. And then you subtract 7 again, 86, and you keep on going down to 0. And I noticed myself after each IV treatment getting worse, and also my symptoms of depression and anxiety and irritability, which I had never had irritability, increased. And after 8 IV treatments and my random testing of the reversal of 7 from 100 going down to 0. I believe I was in the intervention, although I have no way of verifying that because that was neither the patients nor the physicians were
It
told.
was blinded.
I withdrew from the study because I kept getting worse after
You
each
could tell you were getting worse. Now, the first time I spoke to you, you said, it's nice to have a brain.
It
What
is.
did you mean by that statement?
It is so nice because I've been through, like in my confusion state, it's funny now, but it wasn't funny at the time. I'd be empty on gas. I'd pull into the gas station to fill up gas, go to get my pocketbook with my credit card, and I would have left my pocketbook at home. Similar thing would have, and I'd be on empty. Similar thing would have happened at the doctor's office. I'd get there and need to show my insurance card. And I would realize I'd left my pocketbook at home. One of the times I was taking a cognitive test, I was confused and had to randomly guess whether the shorthand was the hour, indicate the hour or the second.
On the
My wake up call, and when I stopped, when I said, hey, Sally, you've got Alzheimer's, let's stop denying this, was when I forgot to pick up my grandchildren twice within 1 month. My grandchildren were small. I was taking them to school. And as every grandmother in the audience knows, if you get a chance to pick up your grandchildren, you're going to pick them up every chance you get. So, you would not forget to pick them up unless you had Alzheimer's. So that was when I had to say, hey, Sally, you've got Alzheimer's. I had to look in the mirror and say, you got it. You didn't want it, but you got it.
Yeah. Can you give us a sense of what it feels like to have Alzheimer's? As time goes on, you get more and more forgetful.
Now it's a sense of hopeful and gratitude to Dr. Bredesen and grateful for the RECODE protocol. And RECODE stands for RE for reversal and code CODE, CO for cognitive decline. So reversal of cognitive decline. Now I'm on the other side of the coin and I have joy. I don't have depression. I don't have anxiety. I don't have irritability unless I'm tired. I can complete a sentence instead of stopping mid-sentence like I was. Most of the time I can find my keys. Most of the time I can remember when I walked from one end of the house to the other what I went there to get, in contrast to I couldn't do all that before. I definitely don't forget to pick up my grandchildren, although they all are driving age now. I also don't call my grandchildren by the incorrect name, which they didn't like, and which I didn't like doing, but I would do. When I had, though, Alzheimer's and knew I had it and did not know about Dr. Bredesen, it was extreme sense of depression, sadness, overwhelm, trying to do what I used to do, basic stuff like getting dressed, going to an activity became hard because I couldn't figure out. It's like I knew I needed to do something.
You just couldn't figure how and what.
But I didn't. It was like a wall was up in my head and my brain would try to make the connection, but a wall would be there and it wouldn't connect. And it was just so frustrating because I didn't realize I use my brain so much. You use your brain constantly and you don't know it until you don't have it. But it's not good. It's very depressing.
Now, how did your family react to your diagnosis when you were actually diagnosed?
Very positive. I sent out an email to my immediate family. I told verbally, and they assured me that, they would take care of me in my advanced stage, which meant a whole lot. But having cared for Alzheimer's patients before, I knew in ways that they didn't know that the Alzheimer's patients, even family, can't take care of your needs because when you have Alzheimer's and can't think clearly, you don't know what's going on. And basic things like going to the bathroom or taking a bath or eating or dressing, you can't figure it out. And so you get agitated when someone else is trying to help you or tell you what to do. So their assurance made me feel loved, but it didn't give me peace because I knew what Alzheimer's was like, which is basically hell on earth for the person, for the family, for caregivers, because it's impossible to meet Alzheimer's need because there's so many needs. And you can't explain what you're doing in a way that the Alzheimer's person can understand, even if you explain it perfectly.
And as time goes on, there's a tendency also for Alzheimer's patients to become paranoid.
Yes.
And depressed. And so, like you said, even when you're trying to help,
yes,
they can fight. They may fight back.
Right.
It's very difficult for the loved ones.
And I always have felt like I'm a loving person, and I didn't want to develop the personality like I've seen in a lot of loving people, of where you get real angry and hostile. But I can understand now, having been confused, how that happens. Because when you can't think and you're trying to think, it's like beating your head against a wall. It hurts.
Yes, absolutely.
And so I can understand why a calm, loving person could go to anger as a way of coping with it. That doesn't make it right or easier, but having lived it, I can understand how it happens.
We know that Alzheimer's is often multifactorial. What were your contributing factors? What factors were affecting you in the development of your Alzheimer's? You've mentioned the mold.
Okay. At the time, before I met Dr. Bredesen, I didn't know of any factors. I'm very grateful for Dr. Bredesen's protocol. And back in 2016, when I did my first cognoscopy, and a cognoscopy is a comprehensive test that includes labs and genetic tests, at which you then compare your results, if, for example, it's a blood value, to what Dr. Bredesen calls the optimal value. I did not know anything that caused my Alzheimer's except my genetics. I knew I had genetics on both sides. But now, back in 2016, Dr. Bredesen identified over 36 different causes. When I got tested for those 36 plus causes, and since then he's identified a lot more, I was positive or abnormal or less than optimal on 35 of them. The only one I did not have was I was not positive for Lyme disease. All the others, my values were off, less than optimal, abnormal. Dr. Bredesen has also grouped the 36 different causes into 6 different categories.
Mm-hmm.
And just as a way of collapsing them, I was positive for 5 of them. The 6th one that I was not positive for was vascular. But for that one, throughout my whole lifetime, I'd always been told by every physician I'd seen, you have great cholesterol, you have wonderful triglycerides. Dr. Bredesen informed me that my total cholesterol was too low. It was 130, and it needed to be at least 150 or higher because your brain functions best on healthy fats.
Right. And no one ever hears that their cholesterol is too low.
Right.
Yeah.
But I still haven't gotten up to 150, but I've gotten up to 149, and my cognition is a lot better when my cholesterol gets high. And I also do the ketogenic diet, which is part of, which is healthy fats and healthy plant-based.
Now, obviously, one of the things that you did not mention is that you also menopausal.
Yes.
And so lack of the hormones obviously is one of the causes of dementia, to be honest.
Well, on that one, I did know, and I was a retired researcher, so I did read a lot. And I did know that estrogen and progesterone was very beneficial for your brain. And when I was perimenopausal and menopausal, I wanted to take the bioidentical hormones. At that time, the physician did not want me to because the Women's Health Study had come out publishing that result that they then rescinded a year later. And I told my physician I had rather die from heart disease or cancer than Alzheimer's. And so I wanted the hormones. So that was my decision. So for that, I was grateful for. But I still struggle on an ongoing basis with maintaining my hormones at the adequate level or the optimal level that Dr. Bredesen identifies. So the need to do a cognoscopy or work with a physician to maintain my hormones at optimal level is critical.
Are you taking the hormones as a cream transdermally or?
Yes. I take the estrogen in a patch, and I take the progesterone as in both a cream and a pill, and I take the testosterone in a cream. Okay. And I also take pregnenolone, and I also take a small dose of DHEA.
DHEA. So when I test people for hormones in my office, those are the 5 main ones: the estrogen, the progesterone, the pregnenolone, DHEA, and testosterone. And a lot of women don't realize that they need testosterone too. Mm. I take it that you believe that Alzheimer's disease is reversible.
Oh, I know it is. I got no doubt. I know how confused I was, and I know how I can think now, and there is no doubt. I'm living proof it can. be reversed. And I've talked to many other people, seen many other people that it has been reversed in.
So what were the key aspects of your treatment? Did you happen to have low zinc or low vitamin D, as many
Yes, and
people
yes.
do?
And yes, low in lots of things. And yes, yes. Unfortunately.
It had a V8.
And then the other nice thing that I didn't know that I learned from my functional physician, my low vitamin D, when I got it up to the optimal level, my depression decreased. So the Dr. Bredesen's approach, from my viewpoint, is not only good for cognition, but it's good for lots of other diseases and lots of other problems. The other neat thing, once I started on the keto flex diet, I used to have achy joints big time, and I no longer do.
I'm so happy for you that you found that there was an alternative. Even though you were in the medical field, you still had that idea that the end was inevitable. And I'm so glad that you were able to find another way. And this is part of why we're doing this podcast, so that other people can realize there is another way.
There is, and it works. It works. It works great. You do have to work. You do have to be willing to change. I think the first thing for your audience who's listening is to get the advantage of Dr. Bredesen's protocol is it's individualized. You do the cognoscopy, and then you treat what you individually have wrong with you.
What's wrong with you? Yeah.
Like my husband.
What's wrong and fix it.
Right. My husband, who's 6 years older than me, 76, he's 82. He has done what's called the pre-code for prevention of cognitive decline. And he only had a few problems wrong, mainly related to vascular problems. You might do the cognoscopy and find minimal to no problems like he did. The other good thing, if you go to the Apollo Health Code website, you can do a cognitive test free at no cost, so you can establish a baseline on what your cognition is.
Now, how long did it take you to start feeling better once you started your treatment protocol?
After a month, I felt better. The first month, I read Dr. Bredesen's article with the 10 patients in 2016. Improved my sleep, and I started doing something I hadn't done before, which was meditating morning and evening, where I would sit down and just listen instead of doing all the talking, which was very hard to do. And within a month, I got better at subtracting the 7 from 100 sequentially, like I just talked to you about. I could do it quicker and I could do it more accurate. At that time, I was making lots of mistakes. And then my improvement has not been a straight uphill. It's been up and down based on other factors that have gone on. I had an artificial recall of an artificial knee that was defective, releasing plastic. So the surgery negatively affected me. I found mold in my home again. That negatively affected me. I've had several health situations that made my cognition decrease. But the good news about it is with the cognoscopy and with Dr. Bredesen's help, and I can identify what I had wrong, correct it, and then my cognition has gone back up. For example, there's a cognitive test that's part of the protocol called the CNS vital signs.
Right.
And my latest score was 86 percentile. Yay.
Wow.
That is 25 percentile higher than the 61% it was 11 months before, when my home had mold in it. I didn't know it, and I was being exposed to it.
And that's not an easy test.
No, it's not.
But it's a lot easier now because you can do it online. You can do it at home. You know, in the old days, we used to have patients come to the office. They had to sit. We had to find a quiet room. Nobody was talk. The patient's concentrating. Now you can do it at home, and, you know, in your own time, the comfort of your home.
Back before I had Alzheimer's, my awareness and my cognition was fairly stable. Now that I do have Alzheimer's, my cognition, like I'm best in the morning, in the evening, after I do take thyroid, after my thyroid has run out, my cognition is not good. So I'm aware that it varies throughout the day, but it also varies with the time period according to what's going on.
And you're paying attention now.
Right.
You're listening to your body.
Yeah.
You're becoming an expert.
Well, unfortunately, I have less brain cells to work with. I think the research study that I was in, where I got 8 IV treatments, I think it not only removed some of the beta amyloid plaques from my brain, I think it also removed brain cells.
Took out some.
And my hippocampus, which is your main place in your brain, where you store memories, was at the 14th percentile, which is really low, in 2016.
Since you brought it up, as a researcher, what do you think of the many Alzheimer's drugs out there? I will tell you that there's not one
My experience
that
is a tragedy, because I got worse, and that means other patients are getting worse.
a lot of people do.
A lot of people get worse. And with the current drug that's been approved, there's brain bleeds and other problems from it. I just think it's a tragedy. I know why some of the researchers are not approving Dr. Bredeson's protocol, and that is because he changes more than one variable at a time. And the standard research protocol for the 20th century, before we had complex organs like the brain we were trying to cure, you only, like in my prostate cancer screening, I only changed one variable at a time.
Just one. Mm-hmm.
And if I had only tried to change one variable in my brain, I'd either be dead or have advanced Alzheimer's in a nursing home.
Yeah.
And the way Dr. Bredeson puts it is the 21st century medicine. We need to recognize that we need to deal with multiple problems at one time.
Yes, and I think the only reason that people take these drugs for Alzheimer's is because they're desperate and they feel that there's no other way.
That's what the physician tells them. And what the drug does is it slows the decline. But having had Alzheimer's and knowing I was confused, why would I want to live longer in that depressive, can't think, agitated, irritable? I don't know of any person I've talked to that says, I want to be confused and I want to live longer confused. I mean, that's just not a wish that anyone would have.
Yeah. Do you have any advice for family members of people with Alzheimer's disease?
It can be reversed if you're willing to change. And for people who have advanced Alzheimer's, there's a nursing home in California under Dr. Heather Sanderson who has shown it can be improved either in advance.
Even when it's
But for the children and the grandchildren, I would definitely encourage you to look at the pre-code prevention of cognitive decline and get enrolled in it. Be tested to see if you have the gene, because if you do have the gene, it has real indications for your inflammation and the way you handle inflammation and several other reactions in your body. But there are things you can do about it. There are lots of things you can do about it.
Do people sometimes say that they don't believe that you ever had Alzheimer's in the first place? And so that's, you're not really proof of reversal because you didn't really have it. How do you convince people that you actually had Alzheimer's or have Alzheimer's and you've reversed your symptoms?
I give them the example of the clock. Most people can identify with that. The example I gave of the grandparent, most grandparents can identify with that. The example of not having your pocketbook and not having money to buy the gas and having to call your husband to come bring money, that convinces them.
There are always going to be skeptical people, but this is why I like to talk to the survivors of Alzheimer's. As I said at the beginning, after a certain number of people have been cured of their Alzheimer's, the naysayers are going to have to say, okay, there's something to this. There's something to this, and start helping people who are going down that road.
I also believe it's a real responsibility for the Alzheimer's researchers to assume responsibility for the wrong path that they've been on. I myself did prostate cancer screening, and that was strongly advocated in the 80s. In the 1990s and 2000s, it started being questioning the efficacy of it. So I know firsthand the dilemma a researcher's in when you spend a career on something and all your publications in that area and you need to switch tracks. But I think there's a real ethical issue in the fact that the Alzheimer's researchers are not accepting Dr. Bredeson's protocol and not looking at it and are still evaluating research based on the 20th century model, not the 21st century model.
Yes, I have difficulty with that myself. I don't understand why we in the healthcare field are having such a hard time moving the needle. It's just, we're here to help people. And when we see that something can be done to help people, I don't understand why we resist it so much, just because it doesn't quite work with the model that we were taught 40 years ago. Why do you think the Alzheimers Association doesn't want to get on board? Are they barking up the wrong tree?
The reason they don't get on board, I think, is because their board is made up of advocates who have all their research tied up with the anti-amyloid theory. It's hard to say I was wrong, that I've hurt lots of patients by giving them these anti-amyloid drugs.
And oftentimes it comes down to the bottom line, the dollar. Of all the things that you did for your program that helped you to reverse your Alzheimer's, could you give us like 4 or 5 things that you think were the most critical?
I'll start with the decision and commitment that I wanted to reverse my Alzheimer's, because for everyone, what they have to do to reverse it varies because everyone's cause varies. But my cognoscopy showed me what was wrong. The one that I still get today and back in 2016 got the most immediate results from were my exercise. After exercise, I can tell my brain is thinking clearer. It's like the blood is flowing and I can make all the connections real clear. The other significant one is sleep. I got tested for sleep apnea by a home testing apparatus I wore in 2016 by a neurologist. It was negative. And then I tested again in 2023 and I had severe sleep apnea. But early on, I increased my sleep from 6 hours to 8 hours. And the mistake I made most of my life was not sleeping long enough, waking up early to do work. So sleep also had immediate benefit. Meditation is one of the first things I did the first month, and I saw an improvement after a month just because I wasn't used to sitting still and being quiet and listening, which was hard to do. Still is hard to do. The mold is a big one, and Dr. Bredesen says that mold is the hardest one to treat of his 6 different causes because it's so complex, because you treat not only your body and the toxins that form in your body as a result of mold, but you also have to treat your home environment. Okay. But I used the example of in March 2023, my cognition was 61 percentile from being exposed to mold, which was a decrease for me. And then 11 months later, I jumped 25 percentile to 86%. And that was after I had removed the mold from my home and started my mold treatment for removing the toxins from my body. And so even though the mold is the hardest to treat, if you have that problem, and let me just say one thing about that. My husband and I lived in the same home. I unfortunately got the genetics that makes me unable to fight off mold, which is estimated 1 out of every 4 people are unable to fight off mold toxicity. Martin lived in the same 2 houses I lived in with mold, and he did not have any obvious problems from it.
Well, speaking of Martin, I'm going to have a quick word with him at the end here, but I know that he has been a wonderful support for you. And I think the people who have Alzheimer's need to find some supportive environment, whether it's relatives or neighbors or, when you realize that you have a memory issue, that's the time to start developing your support group and reaching out and getting the information, figuring out a long-term plan. Do you agree with that?
Yes, because when I was confused, there were a lot of things I couldn't do. Martin took over all our shopping and still does all our shopping for us, whether it's grocery shopping or...
Well, my husband does all the shopping, but I don't have Alzheimer's yet.
But it's a good thing. And most important, sometimes it's overwhelming part of having cognitive problems. You get overwhelmed just because your brain won't connect. So having someone to support you through that makes a tremendous difference. And Martin's been a wonderful support. I'm very, very grateful for him.
My name is Martin Weinrich. I'm Sally's husband.
Okay. And so you are the spouse of an Alzheimer's survivor. Am I correct?
That is correct.
And what do you think about the progress that she has made in the last 4 years?
Oh, it's an absolute miracle. I taught epidemiology and biostatistics so I can evaluate research. The status of this is not proven the way it's proven when you have randomized controlled longitudinal clinical trials. But when you see it with your own eyes, even though it's a case study with a single patient, when that patient's your wife, you know it's the real thing and you know it actually happened. And it's nothing short of a miracle.
I'm glad you took the time to tell us about that, because I think that it's, as you know, Alzheimer's does not just affect the person who's affected, it also affects the family. And a lot of families would love to know that they could get their loved ones back.
And that's why it's so important for the spouse to support the person at risk of Alzheimer's, because it takes a lot of effort and consistency and persistence. But the support from a spouse, including things like any changes in diet or exercise, when you do stuff together, it's so much easier than when the patient or the person who is at risk has to do it on her own or on his own. It is so important to work together as a team.
Well, Martin, thank you for stopping in. And now I will talk to your lovely wife.
A pleasure.
Well, Sally, it's been wonderful talking with you, and I really appreciate you coming on the podcast. I know you've had a lot to do recently, and there's been Easter and the grandkids and all these things, which is great. That means you have a life, right? But I really appreciate you coming on and giving my listeners a sense of A, what it's like to have Alzheimer's, but B, the fact that it can be cured.
It can. It
yes.
can. And it's worth it too.
Yes. I love meeting the survivors, because it's like, okay, people said it can't be done. Here it is. Here's the proof. So Sally is the proof in the pudding today. I hope I have convinced you that Alzheimer's is curable. Please leave me a comment, subscribe. I'm open to all kinds of comments and suggestions from the listening audience. But if there are still naysayers, let's get at it. We'll convince you. We'll convince you one way or the other. So thank you so much for being with me. And I wish you
and best wishes to each member of your audience. It works.
Thank you so much, Sally. It's been delightful. Thank you so much for joining me today on this edition of Wellness and Wisdom. There's not much more to say, really. You listen to Sally and listen to her husband. How can you not realize how important it is for Alzheimer's patients to get care and get treatment and get into a program as early as possible? Alzheimer's can be reversed. It can also be prevented. So let's do our part, and let's make sure that Alzheimer's is a thing of the past. Enjoy. Thank you for listening. Give me a thumbs up, give me a like, give me a comment, whatever you feel inclined to do. And I will talk to you next time. Bye-bye for now.